Your aches and pains are not due to aging. There's a root cause, and addressing the underlying problem will not only restore mobility and free you from pain, it'll improve your overall health and longevity. Take a headache. It's your body trying to tell you something. It's not a deficiency of Advil or Tylenol. Perhaps you've been staring at a computer screen too long without a break. Perhaps you're dehydrated or forgot to have lunch. Maybe you've been exposed to a chemical or a pathogen and your body's trying to detox. Pain medications are some of the most insidious products peddled by the healthcare industry. For starters, Tylenol, paracetamol, Panadol, depending on where in the world you are, or its generic name, acetaminophen, is the leading cause of acute liver failure in the US and also the UK. Scientists can't actually agree on how Tylenol even relieves pain, but it's proven to be toxic to the liver in even small doses, and it's particularly problematic for children and smaller bodies. So ibuprofen, Motrin, and naproxen, Aleve, they're part of a class of drugs called COX-2 inhibitors for their action in the body, and they're also known as non-steroidal anti-inflammatory drugs, NSAIDs. This class includes the infamous Vioxx, which was taken off the market for detrimental effects it had on the cardiovascular system, leading to heart attacks and strokes, and a multi-million-dollar fine to its maker Merck, who'd hidden the evidence. Celebrex is still available from Pfizer, but it has a similarly dubious safety profile, particularly causing gastrointestinal problems, and it's been shown to be no more effective than over-the-counter naproxen at relieving pain. And then we have to bring up the opioid crisis. Drug overdoses of mainly prescription opioids have killed over 1 million people in the US in the last 20 years. The most common drugs involved are OxyContin, that's oxycodone, and hydrocodone, might know it as Vicodin. These are powerful drugs, chemically similar to heroin. They're making physiological addiction really difficult to avoid. The vast majority of lives lost through overdoses, those people started out on valid prescriptions for injuries and surgical pain. And if you think it couldn't happen to you, just watch the TV miniseries Dopesick. It chronicles the rise of OxyContin and the criminal marketing schemes of its maker, Purdue Pharmaceuticals. Okay, so pain is real, injuries are real. What's the alternative? Well, for a start, I want to highlight some of the best new solutions out there that address musculoskeletal problems through a superior AI-enabled approach that treats you in your own home. And the global leader in this category of solutions is called Sword Health. There's also Hinge, Vori, there's a few others. Full disclosure, I've periodically used Sword myself, and you can read about my experience in an article I'll put in the notes. But essentially, you connect with a physical therapist virtually, usually within a couple of days of reaching out. And so they'll initially assess your problem through a Zoom call. Then they'll send you a kit, which will include a tablet. Some of it can do it through your phone. It's using the phone camera and computer vision. Some of them use sensors, and you can just attach to the different parts of the body. But the physical therapist, the PT, they'll tailor a personal program of exercises to you, and then you'll do those exercises in front of the screen with these sensors on, or using the phone camera. And they can tell whether you're doing them correctly and actually adjust you in the moment so that you're really getting the best out of that particular exercise session. Your PT gets immediate feedback after every session. They have a dashboard to see how you did on every single different exercise and how you're moving to it. And you can chat with your PT through the app, and there's various other resources. And you'll have live check-ins via Zoom periodically. But because you're getting feedback on your exercises every single day, you're going to heal much faster than going once a week to those traditional PT offices that might take you away from work for 2 or 3 hours while you drive out to see them. And usually there's quite a wait to get in and see them. And these solutions are making a really huge difference to employers. So think factory workers who hurt their back and need to be off work for weeks while they wait for a consult and then heal slowly under traditional care. versus these new programs are getting them back to work in days, and there's lots of data on them doing this. And then, of course, there's also major savings in avoiding surgery, because the programs are all very focused on, you might even get a surgical consult. And I think I tell in my article the story where an orthopedic surgeon wanted to remove my top rib. This is many years ago, and of course I never did that, and I just did the physical therapy, and I was restored to full mobility. So surgeons cut. So if you get a consult, that's what their recommendation is going to be. But these new programs really work with your body and make sure that you're going to avoid surgery, and that's obviously major healthcare cost savings. But then beyond the physical therapy itself, you're going to get the patient understanding how what they eat and drink affects their inflammation levels and their pain. How critical hydration is to pain and mobility, and simply a few more glasses of plain water a day can really make a radical improvement. And then we've got loads of natural anti-inflammatories like turmeric, and there's tons of clinical science proving that they have a greater efficacy than pharmaceuticals and zero side effects. There's so much I could talk about here, but I've linked to a couple of articles where I go into a bit more detail on the various aspects, and I'm sure we'll talk about it more another time.